Welcome to a basic introduction to mechanical ventilation. This is chapter 3.4, Capnography Uses. Capnography provides a lot of important information about the patient. First, and most importantly, capnography is almost the gold standard for confirming placement of the endotracheal tube. Having all four phases in at least 3 consecutive breaths means the tube is through the vocal cords. It doesn't mean that the tube is not in the right main stem, but at least you know where you're not. If the tube is in the hypopharynx, you may get a signal, but it will become erratic as the tube starts moving around as you're starting to transport the patient. Even if the tube is in the stomach, you may read an initial capnograph, but this will fade away after a few breaths. A flat capnograph doesn't necessarily mean that you're not in the trachea. You can see a flat capnograph in a variety of other circumstances. A prolonged cardiac arrest with very little CO2 production is not an infrequent cause. As well, inadequate pulmonary blood flow and obstruction of the tube or distal to the endotracheal tube can also give you a falsely negative capnograph. Capnography has an important role in transport. Continuous monitoring of the capnography confirms that the endotracheal tube is still in place while you're moving the patient around. It also can be used to monitor the effectiveness of CPR. Better CPR means better blood flow, and there's a direct relationship between the end tidal CO2 and the cardiac output with each compression. In a similar vein, capnography can be used as an early alert to the return of spontaneous circulation. This can occur when there is a sudden jump in cardiac output, but even before the pulse is palpable. Capnography also eliminates the need for pulse checks during CPR. If the end tidal CO2 starts to go up, cardiac output is going up. On the flip side, however, if the end tidal CO2 stays down during a cardiac arrest despite good CPR, then the prognosis is terrible. If the end tidal CO2 is less than 10 after 20 minutes of good CPR, then the probability of death is very, very high. And finally, the capnography is vital in avoiding hyperventilation in head-injured patients. Recall that aggressive hyperventilation is very bad in head trauma as it causes cerebral vasoconstriction and subsequently ischemia. The capnograph is invaluable in maintaining a normal CO2 for that patient and preventing iatrogenic harm with the ventilator.